Assisted reproductive technology includes medical procedures used primarily to address the issue of infertility. Infertility is an issue that affects couples after a year of trying to get fertile. It has become a problem to married couples and even the society as a whole. Whose then fault is it in the issue of infertility? What causes infertility? And then what again are the treatment options to infertility? On today's episode of the Pregnancy Care Show, we would look at infertility and the assisted reproductive technology in infertility. Welcome to another episode of the Pregnancy Care Show. Because you are in the month of infertility, we are looking at infertility, fertility, and all treatment options on today's episode. For today's episode, we are currently at Accra Fertility Center, and I have Dr. Labi with me. He'll be taking us through today's episode and everything we have to know on today's topic on today's episode. My name is Dede. Welcome to the show. Hello, Dr. Labi. Welcome to another episode of the Pregnancy Care Show.
Thank you, Dede.
Okay, so for the sake of our viewers, we would want to find out what you do at Accra Fertility Center, since you are in the month of fertility.
We at Accra Fertility Center, we receive all patients who have a problem with trying to get a baby, conceiving, all. And then we give them the maximum things that we have. And fortunately, we have most of the options available in treating infertile couples. And depending on who your situation is, we do get them get what they want.
That's okay. So for all your fertility and infertility issues, just walk into Accra Fertility Center and get all the help you could have. So go for a short commercial break. When we come back, the show still continues. Welcome back. If you just joined, it's still the Pregnancy Care Show. We are looking at everything in fertility, and all the treatment options available. So Dr. Labi, when we talk of infertility, what should I understand by that?
Of late, we are not using the word infertility because if you say a patient is infertile, it's a more damaging feeling for the patient.
Okay.
So we normally call it subfertility. Infertility, infertile means you may not be able ever to produce a baby, but a subfertility is usually the term we use.
Okay.
And what do we mean by that?
Subfertility.
Normally, couples or women and their partners, when they are married, they do everything possible to get them pregnant. Unfortunately, pregnancy may not occur. Okay. So if you are married for at least for 1 year, and then you realize that you are not getting what you want, you are not getting fertile, that is when we come in and say that, yes, you have a problem with fertility. So after 1 year of married life, consummated marriage means that there is a problem.
So what could be some of the causes of infertility? Is there a cause or is there a risk factor to it?
Oh yes, there are quite a lot. But I have myself divided it into 4 areas.
Okay.
1, egg production. So for any pregnancy to take place, you must have some good eggs or a good egg. 2, the sperm. The man's sperm must be good enough. And later on, we get to know that men, they are always blaming the women.
Yes.
But they are as important as possible. The egg and the sperm, they meet in a place called the fallopian tubes. So that's my third factor.
Okay.
And then, when they meet in the tube, that's where pregnancy takes place.
Yes. Okay.
And the resulting fertilized egg in the tube drops and settles in the womb. So these are the 4 things involved in any couple trying to get pregnant.
Okay.
Name it, whatever it is, it may be fitting in one of these things. And for instance, egg production. We spoke about endometriosis. That's probably not the thing I talk about, but because we have spoken about it, and the egg production becomes a bit deficient. There are some genetic, you are born with it.
Oh, okay.
Yes, egg production is deficient because more or less you have something, you are born with something which is, suppressing your egg production. You have been involved in certain accidents and something, maybe your eggs things are being removed. You've had an operation where the ovary, which bears the eggs, are not. So these are some of the things which affect the egg production, and that makes it difficult to get pregnant. I'm just, mentioning brief things. And then when you come to the sperm, said 1 is the egg, 2, the sperm. When you come to the sperm, most men, they believe that they are okay. But in effect, if we check the sperm analysis, what the sperm looks like, we do get problems there. And there are many reasons that could lead on to that. I said the egg and the sperm, they meet in the tube. So if the tubes are damaged or blocked, how can they meet? And probably this is one of the common causes, and especially because of what had happened to the tubes. If the tubes are infected from any source of infection, if the tubes are blocked, it can always cause you not to get a fertilization. Fertilized egg settles in the womb. The womb itself, normally, most of the causes of infertility part comes from the womb. But for instance, when the baby drops and settles in the womb, as long as the other 3 factors are, and the womb itself is not damaged in some other form, you can get pregnant. I always reiterate, anytime I'm having this chat, that you've heard of fibroids. Fibroids themselves are not the reasons for infertility. But when it's there, it can cause problems.
Okay.
Later with fertility, and then even the treatment of infertility with the presence of fibroids become a bit difficult and things. So these are the 4 main reasons people may not get what they want, right from the time they are trying to get it.
Okay. So from what you are saying, could infertility be genetic? Probably you are just naturally born with it.
Yes.
It could be genetic.
Yes. For some reason, I told you, you may be having some problems with the egg production. It's with the egg production, there is a wholesale problem involving, we call it hormones. It can affect the egg production. And sometimes it's definitely genetic, and that There's a special condition called polycystic ovaries.
Okay.
It's definitely, you are born with it. It's related to some sugar condition or diabetic condition, and your mother or deep relatives, somebody may be harboring that, and because say your mother has diabetes,
Yes.
this PCOS or the condition where you find the difficulty in producing eggs due to this thing I'm talking of, may be the sign that you in future you are going to develop diabetes. But
Okay.
for now, we are having problems with difficulty in reproducing.
Okay. Should women be blamed for the issue of infertility?
Of course not.
Okay. So why not?
Men are 40% culpable. Like, you are married, I told you there are 4 areas we look at. 1, egg. 2, male. And 40% of couples who come to us, the male is at fault. So men are culpable, 40%. Women, the same rate. If you put them together, they have about 20%, which means men are equally responsible for the couple not getting pregnant.
Okay, so do we have treatment options to infertility?
Of course, that's what we are there for. Otherwise, we'll be out of work.
Okay. So we'll go for a short commercial break. When we come back, we'll find out the treatment options for infertility. Welcome back. If you just joined, it's still the Pregnancycare show, and you're in the month of infertility. So we are looking at everything fertility, infertility, and all the treatment options. So Dr. Henekulabi, I asked before you went for the break if there were treatment options, which you said yes. So what are some of them, and what is the commonest one being done in this part of the world?
First of all, I would say that any couple, they walk to our clinic, the first thing is really to talk to them and assess whatever problems they have. And some of them, they don't have any problem, except the fact that they are just gotten married, and after 1 or 2 months, they are coming for fertility treatment. That's not fertility, infertility or something, because I told you it has to be at least a year, at least. However, having said that, you have an elderly woman coming in, we have to, because time is short. Women, you expire, men, we don't. And then, so we have to try and hurry up and things. But the first advice we give is about your lifestyle and how to handle things. For instance, as soon as you immediately get married, how many times a day would you be having sex? Like that. It's so often because you are enthusiastic, you become excited, and you have sex all the time and every minute, that you can. That does not promote fertility.
Oh, okay.
Yes. That's my first advice. You come to me, I will be checking what's going on, how often. And really, newly married couples, they are lucky to get pregnant first shot. But once it's going on, why? Because the sperms you are releasing, they are all weak because of the continuous thing. So we let you settle in a rhythm,
Okay.
which means don't have sex more than 3 times in a week. You are planning to have a baby and not enjoy yourself. Don't have sex not more than 3 times in a week. And that 3 times in a week means 1 shot per day, not 3 times 7 p.m., 9 p.m., like that. No, it doesn't help. So the first approach is it's really counseling, talking to them about that. And with the male, I'm so interested in the male factor because male, you know, like goats, animals, our balls are hanging outside. What do we do for males? What do we do, men? Me, all tucked up there. You think God just did that? No. You are supposed to protect the balls. But because we are wrapped up like this, we are damaging the balls. So that's the first thing that I have to talk to them and tell them. We are talking of treatment options.
Yes, doctor.
So if you don't start with your lifestyle modifications and things like drinking, smoking, and all these may affect the sperm and its production. So you tell them to do all that. Fine. You are convinced that they need help. Check if they are ovulating.
Okay.
We have some means, blood tests. Sometimes you use the ultrasound scan. You can follow up things, but mainly it's a blood testing. Then we move on to man's sperm. We have a simple way called a sperm analysis. And unfortunately, how do they give us the sperm? We ask them to masturbate and drag out the sperm. We send for examination, and under special conditions. Not that you just walk in and give us the sperm. No, we normally ask you to abstain from sex for 5 days.
Oh, okay.
And then all that, because it's important to know the true state of, and that if you are abstain from 5 days, because we don't want you to be having sex all the time, and by the time you want to get your wife pregnant, the sperms are all dead or immature and all that. So we have a way of assessing the sperm quality. I told you the sperm, the egg, they meet in the tube, the so-called fallopian tube. So we have a way or an X-ray mechanism. We put the patient there, they inject a dye into the womb, and it outlines the womb and the tubes. Okay. So that helps us determine if
the tubes
are not blocked. That's where fertilization takes place. And then of course, we have ultrasounds to check whether there's a fibroid or which is situated somewhere, which may block tubes or whatever. But all these tests may be done in any gynecological unit. Not necessarily come to us for that, no.
So viewers, let's go for a short commercial break. When we come back, we'll take questions from our viewers on the streets. Welcome back. If you just joined, it's still the Pregnancy Care Show. I'm here today with Dr. Labi. He's taking us on everything we have to know about fertility, infertility, and all the assisted reproductive technologies we have. So, Dr. Labi, a quick one on surrogacy. What is that? Somebody having to get pregnant for somebody. What are the criteria? How common is it? How expensive is it?
Surrogacy, again, basic. You need the egg, you need the sperm, and then you need the womb to carry the baby. Okay. So for any reason, if there is no womb to carry the baby, or there is a womb but the woman cannot, for any reason, like is very ill, she cannot actually carry pregnancy, it means you've got to go and rent the womb. And this process of getting the egg and the fertilized egg placed in the womb is rather into somebody, that is the so-called surrogacy process. So the mother who carries the womb for you is a surrogate mother.
Okay.
And then the one who is asking the person to carry is an intended mother. Okay. The surrogate mother is just like having, using your womb for rent. Normally, there are two types. One, for instance, the woman who is asking for surrogacy cannot produce eggs, so she should get a donor's egg. Normally, sometimes they will say that the surrogate mother herself should provide the egg.
Okay.
But that practice we don't encourage.
Okay. Let's hit the street to take some questions from our viewers.
My name is Vanessa, and I would like to find out if my insurance card will cover for fertility treatment.
Hi, my name is Kwesi Jan. Doc, please, I want to find out whether infertility is a male or a female problem. Help us understand this and also how to go about it.
My name is Efia. I would like to ask doctor, apart from medical treatment, are there other options for fertility treatment?
Hello, my name is Kelvin. I would like to ask Doc, once you agree to undergo IVF, are there any vital decisions that you need to make?
Welcome back. So those were some questions from our viewers on the street. Dr. Labi, a viewer is asking, is infertility a male or a female problem? I think you spoke about it, but probably we have to answer here.
Yeah, it's, as I said, it's 40% due to the man only, 40% to the woman only, and the combination of them, 20%. So it's a fully shared responsibility between the man and the woman.
Okay. I don't know. For me, I feel that, men produce sperm and semen. So maybe because they feel they are producing semen, it's sperm. Or Dr. Alabi, what do you think? So that's why they don't want to accept the fact that...
No, the thing is, whatever fluid that comes out, if you're able to... people come to us and say that I slept with my husband and all the fluid came and therefore that's why I'm not getting pregnant. And every time it all comes out. You are right in distinguishing between the semen and then the sperm. The sperms are the real guys produced in the testes.
Okay.
Balls hanging outside. The semen is the juice which comes from mainly the prostate glands there. So during intercourse, you find the sperms pushing up, and then the semen, which is mainly the prostatic fluid, is squeezed out to come and meet the sperms and carry the sperms outside. So the fluid itself is a carrier of the sperms. And as soon as they are deposited in the vagina, you see the little ones, they are very aggressive. In seconds, they are already inside the tummy.
Okay.
So the fluid, the semen itself, does not enter the womb. It will you can collapse with the semen itself getting inside the womb. So the quality even of the fluid itself would not propel the sperms out. The quality of the sperms itself. So how can anybody say because I'm just spewing out some fluid, I can get pregnant? The quality of the sperm and then the fluid, the seminal fluid, it could be the cause.
So our next viewer is asking, besides medical treatment, what options do I have?
Really, it's very difficult to treat male problems, very difficult. But the first thing I said was think of how we are like goats. Our balls are hanging outside. It needs to be protected. It needs to be kept a bit cooler than the normal body temperature. And then it does improve. Men smoking alcohol, and that can be, if you can limit or avoid, it will improve the sperm quality.
Well, our last viewer asked, once we agree to undergo an IVF, what decisions need to be made?
Of course, there must be a reason for doing it. So we've discussed with you, you know that you need to have this, and these are the reasons. And that's it.
Okay.
You go and settle your bills, and then
That's your
you
procedure.
start the procedure as soon as practicable.
Okay. So Dr. Heneku, thank you so much for today's episode. I think myself and my viewers, we've learned a lot. I want you to look straight into our camera and give us your final words on today's topic.
Yes, infertility is an interesting situation. And we know that women especially, they get, bothered by their in-laws and that sort of thing. And whether the government also should pay for fertility, this is an issue which I'm sure in future will be discussed.
Yes.
But again, women, your age, you are likely going to develop infertility situation when you are about 40, 38 onwards. So why wait till that time? Why wait? If you are a career woman, get on with it and follow your career later. But waiting for women to, because of career things, progress, is a main source of fertility problems. And young women who also have inordinate sex and things, not necessarily catching sexually transmitted diseases like HIV, but the spread of infection from whatever contact eventually may damage the tubes and things like that. So lifestyle changes for both adults and younger girls is the key to solve fertility problems.
Okay. So thank you, Dr. Alabi, once again for coming on our show. We are so grateful for having you on our show. So to us viewers out there are a lot of treatment options to infertility. Don't sit at home and cry. Don't sit for your in-laws to worry. Just walk into any of the best fertility centers like Accra Fertility Center and get yourself screened and then get all the treatment you could. Thank you for joining us on today's episode of the Pregnancy Care Show. If you have any comments, if you have any questions, leave them in our comment section of all our social media handles at the Pregnancy Care Show. You can send them to my IG page at @dede_. See you next week for a more interesting episode.